Madam President, it's been 1,406 days since the President signed into law the Affordable Care Act. Since that time, about 10 million Americans who have not had access to affordable insurance have gotten it. And patients have been re-empowered along with their doctors to take control of their own health care, taking power back away from the insurance company who had run our medical lives for too long. The presiding officer and I lived through dozens of votes in the House of Representatives to repeal the bill, as the Senate saw as well, but absolutely no genuine effort to replace the health care bill. I was sitting in the chair yesterday when one of our colleagues, Senator Hatch, came down to the floor to talk about a new proposal. I would probably argue the first proposal from Republicans in 1,406 days to actually talk about what their vision, what Republicans' vision for healthcare reform would be. This is a framework, not a bill, just a framework that has been suggested by our colleagues, Senator Hatch and Senator Coburn and Senator Burr. I want to come down to the floor today to talk about the implications of this framework for affordability and patient protections all across this country. First of all, let me say I give some credit to our colleagues because it's been 1,406 days of complaint, of politics, of obfuscation, of obstruction. And at least for the first time, we are beginning to see what the Republican vision for the future of healthcare in this country is. And though we don't have a bill, all we have at this point is a framework. It's a pretty scary future because the proposal from our Republican colleagues would dramatically increase the cost of health care for millions of Americans and would put back in charge the insurance companies of our health care. And so I wanted to just come down for a few minutes today and try to talk in real terms about what this proposal will actually do for health care in this country. And I only have a few minutes, so it's hard to really go through the litany of backward steps that we would take were we to adopt the proposal that's been laid out here by a couple of our very brave Republican colleagues. The first thing it would do is it would reinstate the fact that being a woman for decades in this country was considered to be a pre-existing condition. The health care reform bill says very simply that there can be no difference in the amount of money that you pay for health care based on your gender. Because the facts are plain. Women have historically paid 50% more in terms of health care costs than men have across this country. $1 billion is the total amount of money that women have paid more than men simply because insurance companies believe that being a woman is a pre-existing condition. That is no longer the law of the land. Women pay the same rate as men. There is no difference based on your gender. That would be eliminated by this plan. Once again, being a woman could be considered a pre-existing condition. Second, annual limits on the ability of you to recoup the cost of your health care from your insurance company would be reimposed. The health care bill says, listen, it just isn't fair that you buy a insurance policy, you get really, really sick, and then you get told at some point midway through the year that your insurance is up. That's not real insurance. The idea of insurance is that we all pool our risk together, and that if one of us, through no fault of our own, gets sick, that we actually get those insurance bills paid. Well, the Affordable Care Act says that there can't be any more annual limits, but the proposal from our Republican friends would say that annual limits can come back from insurance companies. And to somebody like Deborah Gauvin from Connecticut, who had a $20,000 limit, was diagnosed with stage 2 breast cancer, hit her limit about halfway through the year, incurred $18,000 of additional cost, causing her to basically forego treatment. Once again, that painful reality of an insurance plan not delivering on insurance simply because you got so sick that you had big costs would once again be the reality. The Republican plan would allow for annual limits again. Our friends talk about the fact that they address the issue of pre-existing conditions, but they really don't. They really don't, because all their plan says is that if you switch plans and you have no gap, that the new plan has to cover whatever illness you may have. But that's not how life works. 89 million Americans on the average year have at least a 1-month gap in coverage. And that 1-month gap in coverage under the Republican plan that's been shown to us in a basic framework would allow for pre-existing condition discrimination to once again be the law. Betty Berger, one of my constituents, had insurance her entire life except for basically about a 1 or 2 month period of time where her husband was switching jobs. And during that time, their son was diagnosed with cancer. The new insurance company at her husband's new employer wouldn't cover the pre-existing condition, and the Bergers lost everything. They lost their home, they lost their savings, their lives were financially ruined. The Affordable Care Act ends that nightmare for families that cause 50% of bankruptcies in this country to be caused by medical debt. The Republican plan does not fix the pre-existing condition discrimination. All it says is that if you don't have any change, any gap in your coverage, then the new insurance company has to cover your pre-existing condition. But for millions of families, that's not how life works. And then lastly, although the Republican plan does acknowledge that the basic underlying wisdom of the Affordable Care Act is right, in that the best way to get coverage to people is to give them a tax credit with which to go buy private insurance. That is the foundation of the Affordable Care Act, and the Republican alternative that our colleagues introduced basically adopts that as their framework for expanding coverage as well. It is at a much lesser subsidy rate with much greater tax consequences to Americans than the Affordable Care Act has in it. For instance, the Republican alternative says that if you hit 300% of the poverty level, that's it, no more subsidy. Well, 300% sounds like a lot. 300 is a big number, but the poverty level is pretty measly in this country. And if you're making 300% of the poverty level, you're making $34,000 a year. And I don't know about the presiding officer's state, but in Connecticut, it's really hard to put food on the table on a consistent basis at $34,000 a year. And then to have no help from the government to buy insurance essentially means that you will have a huge class of people making $30,000 to $40,000 a year who, under the Affordable Care Act, are getting help to buy insurance, who under this alternative plan will get no help. But here's how it's even worse. The Republican alternative that we've seen this framework on says that one of the ways that we're going to pay for this is by taxing people for the health care that they're getting. Right now, if you get health care through your employer, which 150 million Americans do, you get to essentially exclude that money from from taxation. You get those benefits in pre-tax dollars. The Republicans have said, well, we're going to allow that to happen, but only for about 65% of your benefit. So just under half of your health care is now going to be taxable. That is a massive tax increase on the people of this country. Now, we can debate whether there's policy wisdom in limiting the tax exclusion of health care, but let's just admit that if you're going to fund your proposal based on eliminating the tax exclusion of employer-sponsored benefits to employees, then you are dramatically raising taxes on middle-class Americans all across this country. So I give a lot of credit to the senators who have put this framework out there, because it's the first time that we've seen any alternative. But it's a pretty miserable alternative for consumers all across this country who have finally, for the first time, because of the Affordable Care Act, gotten access to affordable insurance. And for countless more Americans who have been insured, who finally feel like all of the tricks and the gimmicks that they've seen from insurance companies, like excluding people from coverage because of a pre-existing condition or putting an annual limit on their coverage, those days are over. So as we go into the debate about the effective implementation of the Affordable Care Act, and as we talk about these alternatives that are now being proposed, it's important that we do that with eyes wide open. Nobody on our side of the aisle who supported the health care reform bill is going to tell you that it is perfect. No one on our side of the aisle is going to defend every step of the implementation, but it is changing the lives of millions of Americans. It is reducing the overall health care expenditure of this government, and it is putting Americans back in charge of their health care. Now is not the time to be discussing going back to the good old days when millions of Americans were left out of the rolls and the ranks of those who were insured, and insurance companies dictated the day-to-day, week-to-week, and month-to-month health care that is so critical to the lives of middle-class families. I yield the floor.